This is Amanda Lawton, Indiana State University student, LPN to BSN program. For community health nursing, I'm going to be discussing childhood obesity and prevention. Upon completion of this video, the viewer will be able to list 4 causes of childhood obesity, list 5 complications associated with childhood obesity, identify the 3 dietary needs of children, to identify the 4 treatments for obesity in children, and identify 4 prevention methods for childhood obesity. Please stop here for a moment to take a pretest to assess your knowledge of childhood obesity and prevention. The link is provided on this slide. Childhood obesity is a serious problem in the United States. Nearly 1 in 5 children and adolescents in the U.S. have obesity. Some groups of children are more affected than others, but all children are at risk of gaining weight that is higher than what is considered healthy. The Centers for Disease Control and Prevention also estimates that 17% of 2 to 19-year-old American children are obese. A child's weight status is different from adult BMI categories. Children's body composition varies as they age and varies between boys and girls. Therefore, BMI levels among children and teens need to be expressed relative to other children of the same age and sex. Body mass index is commonly used to determine childhood weight status. BMI is calculated by dividing a person's weight in kilograms by the square of height in meters. For children and teens, BMI is age and sex specific and is often referred to as BMI for age. CDC growth charts are commonly used to measure the size and growth patterns of children and teens. BMI percentile cutoffs for obesity are intended to reliably define a level above which a child is more likely to have or be at risk of developing obesity-associated adverse health outcomes or diseases. The association between obesity and morbid outcomes makes it a public health concern for children and adolescents. Due to its public health significance, the increasing trend in childhood obesity needs to be closely monitored. However, these trends have proved to be challenging to quantify and compare. While there are many factors and areas to consider when discussing obesity in children and adolescents, there are a few trends that are evident in recent studies. For example, the prevalence of obesity varies among ethnic groups, age, sex, education levels, and socioeconomic status. Obesity is complex. Many factors can contribute to excess weight gain, including behavior, genetics, and taking certain medications. But societal and community factors also matter. Childcare and school environments, neighborhood design, access to healthy, affordable foods and beverages, and access to safe and convenient places for physical activity affect our ability to make healthy choices. Behavior is one contributor to obesity in childhood. Behaviors that influence excess weight gain include eating high-calorie, low-nutrient foods and beverages, medication use, and sleep routines. Not getting enough physical activity and spending too much time on sedentary activities, such as watching television or other screen devices, can lead to weight gain. Eating bigger portions also contributes. Most of us eat and drink too many added sugars. Children under the age of 2 should have no added sugars in their diet, and children over age 2 should keep sugars to less than 10% of their daily calories. Genetics is also a factor of childhood obesity. A child is at increased risk for obesity when at least one parent is obese. However, genes do not necessarily mean a child is destined to be overweight. There are several steps a child can take to lower his risk. Community is also a factor of childhood obesity. It can be difficult to make healthy food choices and get enough physical activity in environments that do not support healthy habits. Also, environment contributes. Easy access to high-calorie junk foods, few opportunities for physical activity, and a lack of parks and playgrounds in some communities are contributing to childhood obesity. Nutritional intake is affecting obesity as well. Many children have a discrepancy between what is taken in and what is expended. For example, children with obesity consume approximately 1,000 calories more than what is necessary for their body to function healthily and to be able to participate in regular physical activities. Physical activity is one of the factors that is most significantly linked to obesity, and this is due to sedentary lifestyle. Each additional hour of television per day increased the prevalence of obesity by 2%. The short-term and long-term effects of obesity on the health of children is a significant concern because of the negative psychological and health consequences. Children with obesity are more likely to become adults with obesity, which increases their risk for many diseases before they even become a teenager. Obesity during childhood can harm the body in a variety of ways. Children who have obesity are more likely to have high blood pressure and high cholesterol, which are risk factors for cardiovascular disease, increased risk of impaired glucose tolerance, insulin resistance, and type 2 diabetes. They may have breathing problems such as asthma and sleep apnea, joint problems, and musculoskeletal discomfort. Also can develop fatty liver disease, gallstones, and gastroesophageal reflux. Childhood obesity is also related to psychological problems such as anxiety and depression, low self-esteem, and lower self-reported quality of life. It can also create social problems such as bullying and stigmas. The future health risks for children who have obesity are that they are more likely to become adults with obesity. Adult obesity is associated with increased risk of several serious health conditions, including heart disease, type 2 diabetes, and cancer. If children have obesity, their obesity and disease risk factors in adulthood are likely to be more severe. As discussed previously, a variety of mechanisms contribute to weight regulation and the development of obesity in children. Different treatments for obesity include environmental factors that are potentially modifiable during childhood and adolescence. Using a combination of different medications and lifestyle modifications can be considered. Weight maintenance programs to slow the progress of weight gain and weight loss surgery might be an option for adolescents with severe obesity who have been unable to lose weight through lifestyle changes. Prevention is the key to success for obesity control, as many but not all obese children will eventually become obese adults. The management of obesity in adults is difficult and often an unsuccessful endeavor. Prevention of childhood obesity, on the other hand, can be more rewarding, providing better chances for reducing long-term complications. There are 3 levels of prevention in dealing with childhood obesity. Primordial prevention deals with keeping a healthy weight and a normal BMI throughout childhood and into the teens. Primary prevention aims to prevent overweight children from becoming obese. And secondary prevention is directed toward the treatment of obesity so as to reduce the comorbidities and reverse overweight and obesity if possible. The number of children with obesity in the United States has increased substantially over the years. Due to its public health significance, the increasing trends need to be closely monitored. While a complete picture of all the risk factors associated with obesity remains hard to measure, many of the studies agree that prevention is the key strategy for controlling the current problem. Please stop here for a moment to take a post-test to assess your knowledge of childhood obesity and prevention. The link is provided in the slide. This is a brochure for parents to understand different ways that they can help to prevent childhood obesity.